All right, welcome to today's episode. Today we've been kind of on the subject of the swine flu and talking about being sick and different things like that. So today I want to talk a little bit about fever, when we need to worry about that, what the warning signs are, basically to kind of put your fears at ease, because I know that a lot of times we get really anxious and concerned when we have a fever or when our children have fevers. Tomorrow's show we're going to start talking more about the body and how it heals itself, and a little more good news. Okay, so the first thing to understand is a fever in and of itself is not something that we need to be concerned about. Now I do have notes here, and I apologize, but this is totally unscripted, so I want to make sure I cover everything. You only need to become concerned about a fever if it's combined with other symptoms. For example, extreme listlessness. The baby or yourself is just very tired, very lethargic, not acting yourself. Abnormal behavior. Things that really cause alarm for you, or respiratory difficulty, difficulty in breathing, maybe some blueness around the lips or blueness in the fingernails. Those things are causes for legitimate concern, and you need to seek medical attention immediately if you have those. I'm going to go through some facts here just to give you a background of what's going on with your body and with a fever. The first fact is this: 98.6 is what we're told is the normal fever, but every human being is different. 98.6 is the average. They've had controlled clinical studies that show normals ranging anywhere from 96.6 all the way up to as high as 99.4. So also keep in mind that your temperature will vary during the day. In the evenings your temperature is a little bit higher than it is in the morning. So these are all factors to keep in mind when taking a temperature, not to get overly concerned. The other fact is that your temperature can rise due to things that are other than a problem. For example, if you're digesting a heavy food or a heavy meal that you just ate. Hormonal fluctuations. A great example of this is women or teens, that when they're ovulating their temperatures will rise. Also medications. A lot of medications can cause changes in temperature. So a lot of times a little change in temperature is not even due to an illness or due to something that should be of concern. Now, fact number 3 is that fevers that should cause you concern are going to come from things that are obvious causes. Now, what do I mean by that? Well, poisoning. If you know that your child has gotten into some cleaning products or some kind of a poison and has ingested that and they have a fever, that's a cause for concern for immediate medical treatment. Heat stroke. Anyone who exerts a lot of effort in, on an extremely hot day, or maybe somebody who sits in a jacuzzi or in a sauna for too long. It is a concern if your body's temperature goes up over 107 degrees, because this can cause permanent brain and body impairment. But again, these things usually will come from poisoning, heat stroke, or overusing a sauna or something like that, something that you know what the cause of it was. These are causes for concern. If you experience this, again, seek immediate medical treatment. Now, and if this happens, if you have a child or someone you love who is playing a sport on an extremely hot day and they lose consciousness even just for a moment, don't hesitate. Take them to the ER. Let them get checked out, make sure that everything's okay, because you don't want any kind of permanent damage from that. Okay? Now, here is another thing. The temperature can vary based on where you take it. For example, if you take it orally and then you take it rectally, typically the rectal temperature will be a degree higher than the oral temperature. If you take it in the armpit or axillary, then that temperature will be a degree lower. Okay, so you've got a variation there. Now this is not true in infants. In infants there's very little deviation between axillary, oral, and rectal temperature. So it's not necessary to take a baby's temperature rectally, because the variation is not that much, and there is a risk of rectal perforation, which is where you tear the lining of the rectum, and that can be fatal. So don't do that. Okay. There is an exception to the rule about not worrying too much about a fever, and that is with a newborn. There are a lot of things that happen during the birthing process. The babies usually are born in a hospital, which can tend to breed a lot of bacteria. There's just a lot of opportunity for a baby to get sick, and typically infants don't run a high fever. So if an infant in the first 2 months of life comes down with a fever over 100 degrees, it's probably a good idea just to be prudent to go ahead and take them in and get them checked out. No reason for panic, but just get them checked out and make sure everything's okay. Alright, now this is a key factor here, okay? Most fevers that people get that are not caused by an external cause, poisoning or heat stroke or whatever, are usually bacterial or viral. Okay? First thing to understand, the height of a fever does not indicate how sick a person is. That's not a relevant factor. Number two, it is safe for a human to have a fever as high as 105 degrees. Number three, the body has a mechanism, even though we don't understand it, the body has a mechanism that will not allow the fever in a person caused by bacteria or virus to go over 106 degrees. Okay? Understand that. You will not go over 106 degrees with a bacterial or a viral fever unless there's some kind of an external cause, being heat stroke, poisoning, or sauna, something like that. But bacteria and virus won't cause you to go over that. So fever alone is not something that you need to be worried about with viral or bacterial infection. Again, there's no relationship to the height of the fever. And the fever, again, will not go over 106 degrees. So the problem with this fact is that most of the time, as soon as we get a little bit of fever, we're trained to take Motrin, we're trained to take aspirin, we're trained to take Tylenol, we're trained to take something to try to lower this fever. And these effects are actually counterproductive. You see, the fever is the body's way of defeating whatever it is that's causing them to be ill. And if you take away this weapon of the body, then you're actually reducing the immune response and increasing the chance of yourself getting sicker. Okay? So please, please, please keep that in mind. It is not necessary to treat a fever from a bacterial or a viral infection. You will be fine. Okay? Fact number 10 is they don't cause, a fever typically will not cause permanent physical or brain damage, even in a situation where you have a possibility of a convulsion, and that can happen when the fever spikes too high too quickly. There have been a lot of studies that show that there is no permanent effect of that. I know it's scary to see it, and I hope that I never do see it, but there are studies that say that it has never caused a permanent effect. Now, if you get that fever temperature over 107, then yeah, you got concern, you need to get some medical treatment with that. But just stay relaxed with the fever. It's not that big of a deal. Okay, so here's a good summary of what to do. If a patient is less than 2 months old and they reach a fever of over 100 degrees, go ahead and take them in and get them checked out. Again, this is for peace of mind and make sure there's nothing serious going on. Number two, no need to call in an older child or an adult. No need to call the doctor unless the fever will not or does not subside for more than 3 days, or it's accompanied by symptoms such as respiratory distress, persistent vomiting, possibility of dehydration, listlessness, and different things that make you concerned that the patient is possibly having some kind of a systemic problem. And you'll know that better than a doctor will, because you'll know the normal behavior. If there is difficulty in breathing, persistent vomiting, or a fever accompanied by twitching or abnormal motion behaviors, then yeah, go ahead and get the person checked out. The chills, when you get chills with a fever, a lot of times we tend to want to bundle up and cover up with a lot of layers. It's okay to get comfortable as much as possible, but don't try to add too many layers, because that'll cause this fever to spike too quickly. And also, it doesn't mean that the patient's cold. It's just the body's mechanism for adapting to the new temperature. So keep that in mind. Always encourage rest for somebody that has a fever. If the cause is from something other than an infection, again, heat stroke, poisoning, long exposure to a sauna, something that caused a fever that is not something that the body can overcome, get them to the doctor immediately. And try to get fluids in, because dehydration is a concern. Okay? I hope this helps. Please leave any comments below or email me any questions that you might have to drpricedc@aol.com. Have a great day. Thanks.